So now let's take a look at the diaphragm, which is forming the floor of the thorax, and simply address those structures that have to pass from the thorax into the abdomen and how they manage to get through the diaphragm. And basically there are three important openings in the diaphragm. We have the hiatus for the inferior vena cava. That's the most anterior of the openings, and therefore it is the highest of the openings, remembering that the diaphragm is a domed structure. So this is going to be higher than openings that are more posterior. That's at the level of the 8th thoracic vertebra. So what goes through the caval hiatus is not only the inferior vena cava, but also the phrenic nerve. The right phrenic nerve goes through there, and after innervating the diaphragm from above, comes around and innervates it from below. Next, most posterior and therefore a little bit lower, is the esophageal hiatus, which passes through the muscular crus or right crus of the diaphragm. And the esophageal hiatus has the esophagus passing through it, but traveling with the esophagus are the vagus nerves. Both vagus nerves are traveling with the esophagus and pass into the abdomen along with it. And then lastly, most posteriorly, and therefore the lowest, at the level of the 12th thoracic vertebra, the esophageal hiatus is at the level of the 10th, at the level of the 12th, and most posterior is the aortic hiatus, and passing through that not only is the aorta, but also the thoracic duct. Okay, so we finished discussing the contents of the thorax, and let's summarize it now and review it by looking at some CT scans. So we'll start with this one, which is a CT scan at the level of the heart. And before we look at the details of it, let's just remind ourselves of how we look at CTs. The convention for looking at an axial CT is that anterior is always on the top, posterior is always on the bottom, the patient's right is always on your left, the patient's left is always on your right. And it's very important that when you start to read these, particularly during the exam, is you keep that orientation. Remind yourself of that orientation, that this is anterior, this is posterior, this is right, and this is left. And that will help reduce your confusion and reduce the likelihood of getting lost. So that means that this is the right lung, this is the left lung. Remember, we've already said that the upper lobe will be anterior and the lower lobe will be posterior because of the obliquity of the oblique fissure. So that means this is the right upper lobe and this is the left upper lobe. This is the right lower lobe. This is the left lower lobe. The right middle lobe would be between the upper and lower. So the right middle lobe would be over here. Turning our attention to the heart now, we have to remind ourselves of what we know about the borders and surfaces of the heart. We know that the right border of the heart is made up of the right atrium, and therefore, since this is the right side of the patient, this is the right lung, therefore this is the right border of the heart, and that's how we know that it is indeed the right atrium. We said that the left border of the heart is the left ventricle, and so left side of patient, left lung, left border of the heart, therefore this is the left ventricle. We said that the anterior wall of the heart is going to be right ventricle. This is anterior, therefore this is right ventricle. And we said that the posterior wall of the heart will be left atrium. And so this is posterior on this side, so that's the left atrium. So identifying the four chambers of the heart is as simple as remembering what comprises the borders and surfaces of the heart, and then just keeping your orientation, remembering that this is right, this is left, this is anterior, and that's posterior. We just made the point that in the posterior mediastinum, the structure that's immediately behind the left atrium is the esophagus. So since we know this is the left atrium, that must be the esophagus. And sure enough, that's what it is. We said that the descending aorta is posterior and to the left of the esophagus, remembering that this is left in that direction, so posterior and to the left of the esophagus. That means that must be the descending aorta. Okay? This, of course, is the vertebral body. There's the vertebral arch with the spinal cord within the vertebral canal. Now, let's take a look at a CT through the superior mediastinum, and we'll look at a few of them. We'll start in the upper region of the superior mediastinum and work our way lower. So here we are. We're in the superior mediastinum. We know that because clearly we're in the chest. We see the ribs and the lungs, but we don't see a heart. So if there's no heart in this image, we must be in the superior mediastinum. And we just went through what comprises the layers of the superior mediastinum, so let's use that information. We said the most posterior layer of the superior mediastinum will be the esophagus, so this is the esophagus right up against the vertebral column. We said layer 2 in front of the esophagus would be the trachea, so right in front of the esophagus is the trachea. And then we said layer 3 is the arterial layer. Now, let me go back a couple of slides for a moment and point out to you that which structures you're going to see in the arterial layer will depend upon what level your cross-section is at. If you're above the aortic arch, you'll see the 3 arteries that are the branches of the aortic arch: brachiocephalic, left common carotid, left subclavian. If you're at the level of the aortic arch, then what you'll see is the aortic arch. And if you're below the aortic arch, what you'll see is the ascending aorta and the descending aorta. So going forward back to where we were, at this level we're above the aortic arch, so what we should see in layer 3 are those 3 branches of the aortic arch: brachiocephalic, left common carotid, left subclavian. Brachiocephalic is always right in front of the trachea, left common carotid is slightly to the left of the trachea, and the left subclavian is more posterior and to the left of the trachea, reflecting the backward arch of the aortic arch. So layer 1, esophagus; layer 2, trachea; layer 3, those arteries. Layer 4 is the venous layer, and here we see the right brachiocephalic vein, and crossing in front of the brachiocephalic trunk is the left brachiocephalic vein. Remember, the veins are in front of the arteries, so that's right brachiocephalic vein, and then crossing obliquely over to the left is the left brachiocephalic vein. And then we said layer 5 would be the thymus, and so this grayish material that we see between the veins and the manubrium of the sternum, that's going to be thymus in there. So layer 1, layer 2, layer 3, layer 4, layer 5. If we go down a little bit lower, we'll be at the level of the aortic arch. Before we look at it, let's anticipate what we will expect to see. The esophagus should be in the same place. The trachea should be in the same place. But the arterial layer, instead of being represented by these 3 branches of the aortic arch, should be represented by the aortic arch itself. And so, let's see. There it is. There's the esophagus in the same place. There's the trachea in the same place. And now, instead of the 3 branches of the aortic arch, we see the aortic arch. And then just to go back for a moment, in the same position where we saw the right brachiocephalic vein, now that we're a little bit lower, those 2 veins have come together, and instead of the right brachiocephalic vein, we now would call that the superior vena cava. So layer 1 is the esophagus, layer 2 is the trachea, layer 3 is the aortic arch, 4 is the SVC, and in here we have the remnants of the thymus, which is mostly fatty in the adult. If we go down a little bit lower, instead of seeing the aortic arch, we'll see the ascending and descending aorta. So we should expect to see the ascending aorta replacing the anterior part of the arch. We should expect to see the descending aorta replacing the posterior end of the arch. We should expect that the middle of the arch would disappear. The esophagus should be in the same place. The trachea should be in the same place. The SVC should be in the same place. So let's see. The esophagus is still there. The trachea is still there. Notice that here it's getting wider because we're now at about the level of T4, and that's as far as the trachea goes. At T4 is where the trachea bifurcates, so we're sort of cutting through the beginning of the bifurcation as it's heading off to its 2 bronchi. So that's layer 1 and layer 2, and then for the arteries, the anterior end of the arch has been replaced by the ascending aorta. The posterior end of the arch has been replaced by the descending aorta. The SVC is still in the same place. So that now concludes our review of the thorax